Welcome to The Better Life with Dr. Mary Ann Pinkston. Join Dr. Pinkston today as she teaches you how an integrative approach to health, combining holistic and contemporary medical information, can lead you to the better life. And now, here's your host, Dr. Mary Ann Pinkston.
Good afternoon, everybody. This is Dr. Mary Ann Pinkston.
Yeah, great intro there.
Isn't that lovely? I love that. That's Shemaiah. That's my producer there at Salem. He is absolutely amazing. So welcome in, everybody, to The Better Life. And I'm kind of excited about this show today because I get a lot of questions about peptides, and peptides can be very confusing to a lot of people. What is a peptide and what does it do? But for those who do know, one in particular is BPC 157. And I think this is one of the most amazing molecules out there. It's been rolled over a little bit through the FDA and, through some legalities and all, which is really unfortunate because it's just a very safe and wonderful thing. But Ray Solano, everybody. And Ray is with PD Labs up in Cedar Park, Texas, and near Austin, and runs a beautiful compounding pharmacy that has supported me for years now and been a good friend. Ray, welcome in. I know you're going to clarify this for us.
Well, thanks for having me. It's always exciting to get to the cutting edge of what the truth is, because there's so much marketing around peptides. We've never seen a time where there's just no governors on medical education in medical these are pharmaceuticals. And it seems to be this line that's blurred between dietary supplements and pharmaceuticals. And so it's important to have this discussion because yes, we want access to medications, and with telemedicine, it seems to be everything's available with a click and a questionnaire. But we want people to understand there is some science behind this. Yes. And you have to, unfortunately, since we have so many different suppliers on a worldwide basis, you really have to know who your supplier is. You really have to know where the source is for these products, because unfortunately, we have most of all of our amino acids or peptides the raw materials are not produced in this country. Mm-hmm. There are very few that are, and the ones that are here in this country are probably 6 to 7 times more expensive than they are everywhere else.
Yes.
So if it is a peptide, which is just an amino acid that are linked together and they have a certain chain, these amino acids are linked together and make when it's over certain combinations called a peptide, these building blocks of proteins, they definitely have to be synthesized. And so when they're synthesized, you have to connect these amino acids, and you got to be able to steps to be able to go to what they call washout, or be able to clear to the next step to be able to assemble. Is like Tetracubes, they're connected one after another. Right. So you have to be able to get a raw material product or a finished product that's efficacious. It doesn't have excipients or have chemicals or have toxic metals or endotoxins. Right. So there's some risks involved there, especially when people are doing injections or they're doing nasal sprays or even topically. We want to make sure there's not other stuff. I mean, let's be let's be honest here. Pharmaceutical companies have a hard time sourcing raw materials to make pharmaceuticals from China. Right. They have excipients or drugs that are contaminated all the time. Absolutely. So it's really important for people to know the source, make sure that they spend the time and have a relationship with the provider so they know where it's coming from. It's really funny. I really marvel at the amount of time people seem that they spend time evaluating their hard liquors in wine more than they do their pharmaceuticals.
Thank you. And there's supplements, right? So, yeah.
I mean, it's just absolutely crazy. It's all the same. But, I tell you, last time you look, there's about 15 different vodkas out there, and everybody will say, well, they all are different. And going, well, you know what? Spend a little bit of time. C157.
Yeah.
PP157 is been around for 20 years. It was isolated in the intestine as body protection compound, and it's naturally occurring as in the GI tract.
Yes.
As a pharmaceutical.
Yes.
As a peptide.
Yeah.
Excuse me a second. So what we find is that this is an amazing compound that tells the body and its macrophages to heal. So it's a signaling peptide. It signals somehow that there's an inflammatory condition, a joint, a leakage, or so it's almost like it has intelligence. It knows how it connects to the body to signal a healing.
Right.
So when it's injected in tendons, it allows the inflammation to be reduced because the body says, okay, we need to heal.
Yes.
So it heals that one spot. And when we do it as nasally, we inhale the inflammation that occurs in the brain.
Right.
When we do it orally, it works very well systemically, but it also has it works very well in the GI tract to stop the inflammation there.
Right.
There's a couple of different salts that are available. BPC is Arginate, and then there's a acetate. Acetate is usually very inexpensive, and we feel strongly the Arginate is 3 times more absorbable. Much more expensive, but it gets absorbed. The most expensive product is the one that doesn't work.
Right.
So that's what we try to make sure that we get the product that works. And so we've done a lot of work with BPC to be absorbed.
Yes.
It's going to be mainstream here as a compounded product again within 2 weeks. So we're excited about it.
That's beautiful. I had a bad tendonitis. We were at a conference, all of us, with Jim Laval and Lauren, you and I had a terrible tendonitis, and we were able to, and this was quite some time ago, but we were able to inject that, and Jim took care of it. And I tell you, poof, and after years and years of coming back over and over, gone. And I just absolutely loved it. And then, of course, disappeared for a while, but thank God it's coming back. And I know
it's available and through special conditions through you. People are looking for the injectable, they can contact you, and we can provide it as a medical provider for our clinic. So this is, people that have a condition, whether it's a joint, to contact you. We also have it in a chewable tablet. We teamed with a pharmaceutical company, SKH Pharmaceuticals, to be able to make these nanosphere liposomes in a chewable form. So we take, with science and a little bit of magic, to take these really small molecules and envelope them in a phospholipid that makes them absorbable on a cellular basis. So you can take something orally and gets lymphatic absorption. So it gets
beautiful.
Poof, it's not going to the liver, and it can stop that inflammation throughout the body. So we've done it as a chewable form, and we've got patients that come to us go, wow, I can't believe how well this works. It's rivals an injection in some cases. So BPC 157 LPT. So that's the name of it. You don't need a prescription for it. It's available on our website. Check us out at pdlabsrx.com, and
Yes.
It's we can ship it right out to you.
That is great that, people can get a hold of that without having to go through a provider. I love that. And I do think it's one of those things that, like vitamin D, it's just one of those naturally good for you type of things, but you definitely want to know how to use it correctly. And like you say, there are different forms of it. And so maybe we can go over that a little bit. I love using the chewable for, gut problems. We talk about leaky gut many times, and that is becoming a more common term for people to understand. Gut problems are so important to, making your brain chemistry and reducing autoimmune disease. So you use the chewable a lot with people with autoimmune, inflammatory issues and all. And again, like the nasal spray, I use that for a lot of neurological issues, to calm the nervous system down, right? Dementia, maybe multiple sclerosis and, things like that. Again, not
brain injury, concussions.
Thank you.
Concussions,
that is the biggest one. Yes.
It works well. And we do it with the synapsin nasal spray. We developed that formula. Yes. We have the original formula, which is much more effective. But check it, the synapsin nasal spray.
Yes.
And these are very foundational supplements or pharmaceuticals that have an amazing effect. I mean, there's not a lot of pharmaceuticals we have on the shelf that do the same thing at all.
Absolutely.
So this is a whole different category. And then the other one that we've tagged that you found to be very helpful is we took the active ingredient in curcumin.
Yes.
And the curcuminoids have been known since the beginning of time as anti-inflammatory and have tremendous Ayurvedic medicine has found that they're so effective for inflammation and having the body help fix itself, as opposed to non-steroidal anti-inflammatories that stop the healing process to get rid of the pain. So we found the active ingredient in the curcuminoids and the tetrahydrocurcumin and be able to put that in a liposphere. So when you put the BPC on one side and the Tetracure together, you take them together, we stop pain and we stop inflammation. That rivals many pain medications.
Yes.
So for post-surgery, you can do your additional pharmaceuticals for a day. It's a great pairing for long-term that works in concert with the body to keep it to heal.
Absolutely.
Great combination. Tetracure
and BPC, right? Yeah. Beautiful. And so a lot of people will buy, curcumin, and, just supplements and general things off of Amazon or things like that. We've talked a lot about quality, but why is curcumin so particular? Why do people really need to watch what they're buying as far as curcumin is concerned?
That's right. Most of the curcumin comes from India.
Right.
And the curcumin, the particle size of the curcumin is so important. You can have it as a food grade, as an item. It's a big molecule, and you got to take 25 grams. 25, you get a huge amount to get a therapeutic effect. So it's important to understand the difference.
Yes.
Now, the ones that we use are very, very small particle sizes, and they don't have heavy metals. Because when you have these things that are mass-produced, curcumins, and they're rinsed with water, you got to make sure there's no lead in these natural substances. When these bulk, you don't need any more lead. You don't need any more mercury. We don't need any endotoxins.
Right. We do not have a deficiency there. Oh.
Yes. So you want a pharmaceutical grade curcumin.
Yes.
And we make it in a liposome capsule, like a liquid in a capsule, doctor-inspired formulas. It's a liquid. It's a liposome capsule. It works very well. But if you want to get even deeper and get a little bit more stronger effect, the LPT chewables is the next generation. A little bit more expensive, but they both work. But it's important to get the material that has the low particle sizes. It doesn't have the added heavy metals, and it's also suitable for human use. So it's really important. Cheaper is not better. And I just, there's about 10% of the products on Amazon that are just counterfeit. Yeah. So I would just be really careful about what you buy.
Absolutely. And that's true for, many of the products, but curcumin is one of those big ones. And so, in those combinations, so inflammation is is an enormous problem for so many now. I think it's based on a lot of changes in our food supply and, stress and many underlying things. But, many folks will try different things to, get at inflammation. But what is so important about and difficult about treating inflammation?
Well, it's the inflammation that you want to slow the inflammation, but you also want to not arrest the healing.
Right.
So this is where when you take non-steroidal anti-inflammatories like Motrin or ibuprofen, you may stop some of the inflammation, but it stalls the healing macrophage. I guess it's the macrophages that come on and heal the injury. It's almost like a scab, right? It's going over the surface and healing the wound. But that healing, that wound process, you got to make sure you stop that healing. You'll have chronic tendonitis. You'll have chronic tennis elbow. You have chronic injuries that take more Advil and more combination. But that's what everybody wants you to do. So you got to stop the cycle and the craziness. So this is the reason why this combination I think is perfect.
Absolutely. And natural. So, we always want to go with something that is natural.
And the ancients have done this forever. So it's just probably our modern techniques and profiteering have figured out that this is a better way and throw out 1,000 years of Ayurvedic medicine. It's crazy.
Absolutely. And there's a lot of ways to get at inflammation, and these are two good ones. But I know there's more to it, and it depends on what you're trying to attack. Things that like autoimmunity or long-term neurological changes. So it whatever is happening to you now, it manifested probably about 15 to 20 years ago, right? And so I think many expect to take something and change it immediately. And is it true that it's a process? You have to kind of give it some time.
Yeah, exactly. And so we're definitely learning a lot more. And I have to give you a compliment. There are so few practitioners that are willing to look around and say, what is the best tools that are out there, as opposed to what may be on the shelf from a pharmaceutical manufacturer.
Absolutely.
And off-label using is common for what you're looking for because you live it yourself. But many other practitioners, we were at a conference in Las Vegas, the Women's Health Initiative Nurse Practitioners. And we had people coming up to us and saying, we've heard about this BHRT for hormone replacement therapy. We've just heard about it. We've never used it, but is it safe? And we're going, wait a minute. This has been around for 20 years. Yeah, but we've been told we can't use it. So what's happening is all these women have been not available for hormone replacement therapy. And then on top of it, the big pharmaceutical companies are using non-hormonal replacement for hot flashes. They're using vasomotor central nerve deficiencies that are almost antidepressants, and they have super high contraindications for liver dysbiosis for people that have inflamed liver. So wait a minute, let me get this. Just wait a minute. I'm sorry, I just was like in shock. I couldn't believe what I was seeing.
Absolutely right.
Don't use the hormones. You're low on the hormones. So don't replace the hormones because they're dangerous. So
Yeah.
I don't know. But you guess what? The consumers, your patients, are smarter. They see the writing on the wall.
They do.
They know what works. And if a new pharmaceutical works better, then great. We're all for it. But
Sure.
Last time I saw, there's a lot of people at happy hour that if you're banging happy hour, and the menopause women I'm talking to, and they went, "Oh no, that's
right.
not happened."
Yeah, good. You are so right. So, yeah.
Anyway,
they are. People are smarter these days, and
let me get this.
Sure.
You can't use any high fructose corn syrup. You can't use, because you don't have fatty liver. You can't use any alcohol. You're not going to have any alcohol.
Yeah.
And by the way, your carbohydrate usage has to be improved because your insulin resistance is what's causing the problem. Well, you can take this drug, and by the way, it may have some depression side effects. Other than that, it's okay. And by the way, it may be a zero copay. I don't know.
Yeah.
Wow. So congratulations. You're that's why they can call you and get help right away.
Absolutely. And thank you for that compliment. Yeah. My eyes were opened about, probably about 20 years ago when a, compounding pharmacy group that I knew at the time offered to pay my way to Vegas for one of the PCAA conferences, or A4M. And there were a lot of great people there that we both know now, and said, you are a great practitioner. We know that if you just open your eyes and your mind to this, that you will adopt it. And so I went, and the light bulb went off, and once it goes off, you can't turn it off. It's just the truth. Right. So I appreciated that very much. And that changed everything forever. And actually, I'd like to talk a little bit more about some of the hormone replacement, but I am going to ask that we take a very short break. And I know there's some information that you have for our audience, and on your little commercial now. So we'll take a very short break and be right back, and we'll talk about it.
Hi, this is pharmacist Ray Solano with your Healthy Choices Minute, sponsored by PD Labs Pharmacy. Freedom to choose your physicians and medicine is a practice celebrated in this country forever. Today, the public has spoken, and the FDA reversed its removal of natural thyroid as a proven pharmaceutical. Yes, victory for patients everywhere currently on thyroid medication. PD Labs Pharmacy is dedicated to patients' choice for personalized medicine shown to improve the quality of life and reverse many chronic diseases like mold, Lyme, cognitive decline, and of course, rebalance your hormones. PD Labs is a nationally licensed compounding pharmacy, and we serve patients everywhere. Check out our website, pdlabsrx.com, or call us today at 888-909-0110 and mention this ad, and we'll give you $25 towards your discount of natural thyroid medication. And our website is pdlabsrx.com. Call us at 888-909-0110. Remember, you have a choice in healthcare.
I want to go back to hormones here in a second, but what you're offering there for thyroid, if people will go back and look at one of our previous shows, we talked a lot about thyroid. That got a lot of attention and loved it. So I hope people kind of go back and take a look at that. But on the hormone replacement, so I know this is opening a can of worms, but that's another thing provided, compounding versus pharmaceuticals, which you dove into just a minute there. But I wanted to expand upon that, about the difference between the pharmaceuticals and then the pharmaceutical more synthetic and compounded more natural. What is the difference between synthetic and natural? Can you explain?
Well, it's, synthetically, as for most cases like progesterone, has been similar molecule,
right?
Because many times progesterone molecule is not something that can be patented as a pharmaceutical. So we have something that's similar, like a progestin. And for many years, they used hormones that were similar from horse serum or horse urine for years. So they were similar molecules. not the same. So the word bioidentical is the same structure that is found. And so the body sees it as the same as opposed to having to change it. Now, there are some pharmaceuticals now that are available, that are pre-manufactured for progesterone that are bioidentical, and but unfortunately, the dosing is not the same. Now, it may work for some people, but you want progesterone USP, not progestins.
Yes,
they're not the same. And
they're not.
But if the dosing is not correct, then that's where we personalize the dose and be able to have different strengths. So that's important, or in combination. So estrate patch has estradiol is available, but so sometimes people need different combinations. So you want hormones that are the same structure as your body. So estradiol, estriol, progesterone, that is the same. And if the dose is not right, well, don't just settle for. Try to get something that's exactly what your body needs, because sometimes one size does not fit everybody. So it's really important to get the right dosage.
Yes, absolutely. And that combination and that customization, I think, is what's so important. Knowing that you are getting something that is sourced correctly, as you mentioned in the beginning of the show, but the correct dosage for you. Your practitioner has to listen to you and what you're experiencing, and then you guys have to design that. We order it, and you guys have to design that. There's a lot of personalization that goes into this, and especially a safe molecule. My understanding is that these compounded hormones have been studied and used since the 1930s. And so the technology has been around. Can you imagine? That is almost 100 years now. It blows my mind. Almost 100 years. So that's been around a lot longer than the synthetics, for sure. Right. So really, we know the safety and efficacy, behind these. So I'm glad you touched on that. I appreciate that very much. And so, what did we miss this morning? Or this afternoon? I don't know. What time is it, guys? What have we missed? Is there anything that you want to add on?
Well, just our contact information. We follow patients. You work with patients, get them started. We follow up with patients. So try us out, pdlabsrx.com. Check out our website, pdlabsrx.com, for more information and how we can help you, and all the items we talked about on our website. Look under the shop page and give us a call if you have any questions. We can be able to point you in the right direction.
Absolutely. And I appreciate that. Yes. And so in that, we have about 3.5 years of shows back behind us now, once a month. And so if people want to go look at some of that information, go to drpbetterlife.com. You'll have your choice of iTunes, Spotify, iHeartRadio, YouTube, where you can actually see our little mugs on the screen. And so please check out some of our previous shows, and then information and links to PD Labs, where you can go a straight shot there and take a look at everything they've got. Wonderful, Ray. I always appreciate you so much.
Well, thank you. And check out our Doctor Talks.
Yes.
Under Healthy Choices, our podcast, under Doctor Talks, Healthy Choices. You'll see all the huge library of free information, cutting edge, great interviews that really have a foundation in true science and without a bunch of marketing. So check it out.
Absolutely. Yeah. And that we appreciate as well. So very good, guys. Well, I hope everybody has a wonderful week. You too, Ray. Thank you. And we'll see you in about a month. Everybody take care of each other out there. Appreciate it. We'll see you soon.
You've been enjoying The Better Life with Dr. Mary Ann Pinkston. For more information, go to drpthebetterlife.com. That's drpthebetterlife.com. And listen next week for The Better Life with Dr. Pinkston.